The charge, the nation's largest HMO, Kaiser Permanente, has put money before medicine.
It's bad enough to steal people's money, but it's terrible to take their money and let them die as well.
The evidence, this document, a speech on the bottom line by a senior Kaiser official.
This was a smoking gun. This was a smoking gun that is, in my eyes, still smoking.
The denial.
Dr. Boat was exaggerating, making jokes, and telling untruths to please the audience that he was addressing.
Tonight, care versus cost. Outraged jurors speak out. It begins with a malpractice lawsuit in Texas. A family claiming the negligence of the country's largest HMO, Kaiser Permanente, left their loved one dead. During the trial, startling evidence emerged, an internal speech by a Kaiser administrator. The administrator painted a picture of a company that appeared willing to risk placing profit above patient welfare. Together with the rest of the evidence, the speech stunned jurors and helped drive Kaiser to settle the lawsuit for millions. At the heart of all this, the public's growing fear of health maintenance organizations. Kaiser Permanente has itself endured dozens of lawsuits and 3 blistering government investigations, while across the country, HMOs are losing money and consumer confidence and facing demands for tough new legislation. All this at the same time that more people than ever before are provided medical coverage by HMOs. What's gone wrong with a system intended to help contain the boiling growth in the cost of health care? Tonight, the nation's wealthiest HMO and why a jury was left outraged. First, ABC's Valerie Williams.
Just before Christmas in 1994, Ron Henderson danced at his daughter's wedding. Less than a year later, the Dallas technician was dead from a heart attack.
It was terrible. It was an awful ordeal to go through. This wasn't a sudden death. This came on for 5.5 weeks. This man asked repeatedly for help from the doctor, and it wasn't given.
Henderson's medical files document all the warning signs, including an abnormal EKG and a previous heart attack. But Henderson's family says his HMO denied him access to either specialists or critical tests. Instead, he was diagnosed with a hiatal hernia.
You cannot just say, well, I'm sure it's my heart, I'm going to a specialist. You cannot go to a cardiologist without a written referral from Kaiser doctor. And if they don't give you one, you just don't go.
Henderson's HMO was Kaiser Permanente of Texas, the same HMO of former Dallas school teacher Cynthia Comfer.
You think Kaiser let her die?
Yes, I do. They had all kinds of opportunities to prevent her from dying. And what she died of is as simple as having appendicitis.
Comfer died when the aorta to her heart ruptured. Her family says, like Ron Henderson, all the warning signs were there. Comfer's medical file repeatedly notes she had a potentially dangerous heart condition from a dilated or enlarged aorta. But Comfer was never referred to a cardiologist. The diagnosis of a Kaiser physician? Bronchitis.
Just very, very upset.
Why?
There's no excuse for letting people die this way.
Kaiser Permanente was also the HMO of Dallas preacher Jim Morgan, another heart attack patient. Again, like Ron Henderson, Morgan had an abnormal EKG. He also had high blood pressure and high cholesterol. But Morgan's family says he was never referred for further tests or to see a specialist. The diagnosis of a Kaiser doctor? Sore ribs.
You trust your doctor. That's someone that you can always trust as your doctor. You cannot trust Kaiser.
Morgan, Comfer, and Henderson all died in the same city within 7 months of one another from serious heart problems. Kaiser Permanente denies any wrongdoing. But just recently, the HMO settled lawsuits with all 3 families. who believed Kaiser was pressuring its doctors to cut back on referrals for tests to the hospital and to see specialists in order to save money. They talked with Nightline before signing confidentiality agreements.
The thought that this man's life was wasted and no one knew or cared about it. They need to start caring about these patients more than they care about the bottom dollar.
Indeed, what each of these families sued over is exactly what many Americans suspect about their own HMOs. According to a Harvard University study, 55% of managed care patients believed that if they became ill, their plan would be more interested in saving money than in providing the best medical treatment.
Reinforcing that fear is this document that emerged as a damaging piece of evidence during the Hendersons' lawsuit. It's a copy of a speech given by a Kaiser official, and some are now calling it a smoking gun.
Help me in terms of importance to the bottom line.
Dr. John Vogt is that official. He's an associate medical director at Kaiser Permanente in Texas. Little did Vogt know that when he gave that speech to an HMO industry conference in 1995, that it would become such a damaging piece of evidence. The topic? Cutting costs. And these are some of his more controversial remarks. The first thing that ever comes out of a Kaiser CEO now is what's the bottom line? And anytime you have to balance the budget, how do you do it? You cut utilization, drop referral rates, drop your hospitalization. The budget balances. We all go home. And Vogt continued. At one point, he refers to Kaiser's urgent care centers, or UCCs. Quote, "We basically said to the UCC doctors, if you value your job, you won't say anything about hospitalization. All you'll say is, I think you need further evaluation, and Dr. Schmo is going to come in and talk with you."
I think it is the best snapshot this country has ever had of what managed care is really about. I think for the first time, we kind of got to get under the rock and see what was going on. And what we saw was what we're all scared of. And I think it's the clearest picture we may ever see of what is going on with HMOs.
Item. This confidential business plan outlines Kaiser's intention of aggressively reducing hospitalization expenses by 45%.
I found out in the testimony that they have a computer program that they can actually watch the hospital utilization on a daily basis, and it's like watching the stock market or something. One day it's up, next day it's down. If it's down, everybody gets pats on the back, and if it's up, then the caning starts from the top and goes on down to the bottom.
He told me he had chest pains across the arms, and that's the way I took it.
Item. A videotaped deposition given by what Kaiser refers to as a medical advice nurse, whose job is to screen all calls for emergency treatment. Using a script and a checklist like this, she makes life and death decisions over the phone.
According to testimony, Ron Henderson told the medical advice nurse that he had severe pain throughout his chest and arms, classic heart attack symptoms. But she refused to authorize a trip to the emergency room because Henderson didn't use the word radiating, which was on her list.
I can't put down radiating because he didn't tell me radiating.
Well, do you expect the patient or the member to make a determination whether he has radiating chest pain?
Well, if it goes across the arms.
That's radiating, isn't it?
You've lost a lot of money last year. Do you see the upside in the next year?
We sure hope to, and I can promise you this, it will not come at the expense of quality. It will come because we continue to improve quality. Remember one thing, I think it's terribly important, that one of the things that's going on in the United States before managed care and with managed care is that hospitals, for example, have to be used very, very carefully. People get sick in hospitals. People die in hospitals from the medication and treatment errors that occur there. So we're going to be looking for every opportunity we can find to improve quality, because that's the best and most effective way of taking care of our patients and taking care of the bottom line.
Dr. David Lawrence, Chief Executive Officer for Kaiser Permanente, thank you for joining us, sir.
Thank you. That one of the things that's going on in the United States before managed care and with managed care is that hospitals, for example, have to be used very, very carefully. People get sick in hospitals. People die in hospitals from the medication and treatment errors that occur there.
If your insurance policy says you're covered for mental health, check it out while you still have your wits about you. As we reported last year, your policy may say you'll get quality treatment and hospital care, but in the brave new world of managed care, your actual treatment will probably be determined by someone who never even sees you. Psychiatrists tell us insurance companies often block them from giving treatment patients desperately need. Take the case of Lynn Mizell and her son Gregory, who suffered from depression. Their odyssey into the labyrinth of managed mental health care began late one night when police came knocking at the door.
They were at the door because Gregory had been on the phone with a girlfriend, and she called 911.
Because of what he was saying to her. And he was saying he was going to kill himself.
Yeah, and she made him promise that he wouldn't do it. And he made that promise and then went downstairs and took all of the antidepressants that he had.
He was rushed to an emergency room and then taken to Holly Hill, the only psychiatric hospital in Raleigh, North Carolina that was covered by Cigna, the family's insurance company. Lynn was confident her son would be well looked after. The policy entitled them to up to $500,000 worth of mental health coverage. But just 2 days after his suicide attempt, the hospital told Lynn to take her son home.
I would expect somebody to be discharged after they showed some type of improvement.
But was there any indication by any doctor that your son was improving?
No. No.
Within days, Gregory became violent and attacked his mother. She took him back to Holly Hill, where a psychologist examined him and reported that Gregory was at high risk for self-harm. Hospitalization seems essential. But the very next day, MCC Behavioral Care, part of Cigna, refused to pay for more hospital treatment. They said that after careful review, their doctor, psychiatrist John Robinson, has determined that inpatient care is not medically necessary. Did Dr. Robinson ever see your son?
No. No.
Ever talk to him?
No, I don't even really know who he is. He's a name on a page.
Ever talk to you?
No.
Who is Dr. Robinson?
I wish you'd find out.
We did. Dr. John Robinson, who declined to talk to us, works only part-time for MCC at its Maryland office, and that careful review took place 300 miles from Gregory Mizell. Such hands-off judgments are standard operating procedure in managed mental health care.
You ever hear people say, well, there can be good managed care, right? No, there can't be.
Psychologists, social workers, and therapists across the country have banded together to resist the powerful hand of managed care. They say they can no longer work in the best interest of their patients, that crucial mental health decisions have been taken away from them and given to managed care companies, whose only contact with the patient is the telephone.
This is Karen. How may I help you? Okay, and tell me why you're seeking treatment today.
At Vista Behavioral Health Plans in San Diego,
And you're the policyholder?
phone operators screen patients and decide what kind of professional they should see.
Are you having any problems with depression?
A caseworker then decides what kind of treatment and how much treatment the company will pay for. These people were making medical judgments about patients without ever seeing the patient.
That's right. They never saw the patient.
Psychologist Ray Mount had a lucrative practice working with managed care. He says the system ground him down.
For example, if I assigned the patient a mild depression diagnosis, the managed care company would have a certain number of sessions that this patient would be allotted, and that's it.
You mean mild depression, you get 6 sessions.
Right.
Light depression, you get 3 sessions.
Exactly.
And if a psychologist asks for more sessions, he told us, he risks getting fired.
Now, let's say the average depressed patient requires 9 sessions with me. And with you, the other therapist in town, your report card is only 6 sessions. And if you're a managed care company, who are you going to keep? So you and I are both challenged to keep the sessions to the bare bones minimum. Is Christy Vale there, please?
Dr. Mount believes he was dropped by Cigna's mental health company, MCC, because he tried to get more sessions for a troubled 10-year-old girl. MCC told him and us it was simply because the company was downsizing in Massachusetts.
Hi, come on in.
Dr. Harold Eist, the president of the American Psychiatric Association, has declared war on managed care. He says it's easier for companies to deny care to the mentally ill because the patients often are incapable of making decisions, incapable of fighting back.
Do you think there's a conscious effort to take advantage of the mentally ill because they are mentally ill?
Absolutely.
He says one insurance company executive even admitted to it.
In fact, I said, why are you doing this to the mentally ill? He said to me, because they're vulnerable. I vow that I will fight this scourge of managed care harder and harder, because it's not care, it's managed cost, and as somebody said, mangled care.
Please tell me in the non-managed fee-for-service system how there's any kind of checks at all on the quality and appropriateness of medical care, other than, trust me, I'm a doctor.
Well, that's the beginning. What you're saying is, don't trust him, he's a doctor, trust us. We're businessmen.
Well, what we're saying to employers is that, yes, you need to trust us because we hire professionals who will make these determinations to make sure that your company is spending its resources wisely on mental health treatment.
We've heard time after time from psychologists, psychiatrists, that managed care, for-profit managed care companies, deny treatment in order to enhance profit.
But you hear it from a vocal minority who's trying to hang on to the way things used to be, where if you were in private practice, you could pretty much do whatever you want. You weren't accountable to anyone.
HMOs say with mental illness, with any kind of illness, the main aim is to get that patient better as quickly as possible. And the old psychiatric establishment wants to extend and extend and extend and collect and collect and collect for long-term treatment.
Yes, they say that. But they delay access to care. They don't provide sufficient care. They throw people out of the hospital too soon, people who are still very, very ill. So how can they possibly get people better quicker? What they try to do is put a Band-Aid on and get rid of people quicker.
The story of Gregory Mizell has a tragic ending. He did kill himself. His mother sued the insurance company for denying her son the care he needed. Last month, MCC Cigna agreed to a confidential financial settlement.